Managing high blood pressure as a senior, the silent risk. You can beat. High blood pressure, often called the silent killer, is one of the most widespread health concerns among older adults. It sneaks up without symptoms or pain, making it easy to overlook. But the consequences can be severe: strokes, heart attacks, kidney problems, and even memory loss. What makes it especially dangerous for seniors is how easy it is to miss the small habits that cause it or make it worse. Managing blood pressure isn't just about taking medicine, it's about awareness, routine, and making smart choices every day. One of the most common mistakes seniors make is skipping or mismanaging their medications. Some forget a dose, others take pills at the wrong time, and a few stop taking them altogether because they feel fine. But high blood pressure is tricky. It doesn't show symptoms until something serious happens. Medications work behind the scenes, keeping the pressure controlled and preventing long-term damage. Using tools like pill organizers, setting reminders on your phone, and having open conversations with your doctor about side effects can help ensure you're staying on track. Even if you feel well, never stop taking your prescribed medication without medical advice. It's your invisible armor. Another major issue is consuming too much sodium, often without realizing it. Many processed and packaged foods, including canned soups, frozen dinners, crackers, and even healthy snacks, are loaded with hidden salt. You might think you're eating right, but sodium sneaks in where you least expect it. The body doesn't need much salt to function, and too much can raise your blood pressure dramatically. The best way to cut back is to start reading labels, cook with fresh ingredients, and flavor your meals with herbs and spices instead of salt. Choosing low-sodium alternatives and limiting fast food can make a huge difference. If it comes in a box or a bag, check the label before you eat it. Many seniors also make the mistake of not regularly checking their blood pressure at home. They wait for their doctor visits, which might only happen every few months. The problem is, blood pressure can fluctuate daily, even hourly. Stress, food, medication timing, and activity levels can all affect readings. Having a home monitor and using it at consistent times each day gives a clearer picture of your health. Keeping a blood pressure diary and sharing it with your doctor can help with accurate treatment decisions. This small daily habit can catch problems early and prevent big issues later. Stress is another silent contributor to high blood pressure, and unfortunately, it's something many seniors live with quietly. Whether it's worry about health, finances, family, or loneliness, stress tightens blood vessels and increases pressure in the body. Over time, unmanaged stress wears down the heart and other organs. That's why finding ways to unwind is essential, not optional. Deep breathing exercises, meditation, light yoga, or simply spending time with a pet or listening to music can help calm your system. Identifying what helps you relax and making it a part of your routine is just as important as taking your pills or eating healthy. Physical inactivity is a widespread issue that affects blood pressure significantly. As we age, aches, pains, or fear of falling might keep us seated more often. But staying still for too long weakens the heart, leads to weight gain, and increases the risk of high blood pressure. You don't need to run or lift heavy weights to benefit. Even a daily 15-minute walk, stretching in the living room, light gardening, or dancing to music can strengthen the heart and lower blood pressure. It's about finding movement that feels good to your body. Every bit counts. Consistency is key, not intensity. Caffeine and alcohol are often part of daily routines, but when overused, they can quietly raise blood pressure and interfere with medications. For some people, even moderate caffeine intake can cause spikes. Alcohol, too, especially in larger amounts, raises blood pressure over time. It's okay to enjoy coffee or a drink occasionally, but moderation is crucial. Try limiting coffee to 1 or 2 cups a day, switch to decaf or herbal teas, and drink plenty of water. If you enjoy alcohol, keep it to 1 small glass per day, and always talk to your doctor about how it may interact with your prescriptions. Lastly, poor communication with healthcare providers is a mistake that's easy to fix but often overlooked. Some seniors hesitate to ask questions or admit they're not following the treatment plan. Others assume their doctor knows everything just from a quick checkup. But high blood pressure management is a team effort, sharing your home readings, discussing side effects, and being honest about